Well, on dealing with, are we here to help the most vulnerable in our society? I think this bill before us does. And you mentioned that it was a bipartisan bill, worked bipartisan. Matter of fact, the text before us today was actually included in the end of last year's bill. It was agreed upon, and the text of this bill was agreed upon in the four corners as it came to the end of the year bill, which obviously didn't pass. But that's why we're here today, because for far too long, Americans have witnessed the unprecedented rise in drug overdoses and substance use disorders, creating an imminent need for prevention, treatment, and recovery services. The opioid epidemic and its associated overdose deaths have ravaged communities across the country. According to the most recent data, the CDC, approximately 87,000 Americans have died due to overdoses from September 2023 to October 2024. My home state of Kentucky saw close to 2,000 overdose deaths in 2023. While these numbers represent a slight and a welcome decline in overdose deaths, we must remember that we still have these deaths, and each number represents somebody's family member, a friend, or a neighbor, and all of us have been touched in some way. And I'm hopeful these numbers continue to decline and our communities receive a much-needed respite from an epidemic that has gone on for decades. This decline in overdose rates is a result of the significant investments we made in treatment and recovery. The work we have done in the previous Congress, as I reiterate, is bipartisan, that we are reauthorizing today is vital to ensure these overdose rates continue to decline. I'm grateful to be here today to discuss H.R. 2483, the Support for Patients and Communities Reauthorization Act of 2025, and how this legislation builds off the important work established by the original Support Act, which was signed into law by President Trump in 2018. We're reauthorizing key public health programs focused on prevention, treatment, and recovery for patients with substance use disorder. The Support Act continues to supply resources for individuals and families impacted by fetal alcohol spectrum disorder, promotes state choice and prescription drug monitoring programs, and allows for educational opportunities regarding the unique dangers of fentanyl-contaminated drugs. I am very proud of the bipartisan work members of the Committee on Energy and Commerce have put into helping craft this Support Act. This is a common-sense bill that received a strong and bipartisan voting committee. Between both the 118th and the 119th Congresses, Energy and Commerce Committee members have heard testimony from nearly 30 experts on how lawmakers can improve policies related to prevention, treatment, and recovery for substance use disorder, as well as ways Congress can be more proactive in combating existing emergency drug threats. I'm reminded of the powerful testimony presented by Ray Cullen, who lost his son, Zach. He was just 9 days past his 23rd birthday when he was targeted by a drug dealer and ultimately poisoned by the drugs. Ray powerfully recited for us the prayer he read at his son's funeral. He and his family, along with many others, have experienced immeasurable pain from losing a child or a loved one. Their message is always the same. We need to get these lethal poisons off our streets and increase access to both treatment and recovery services for those who need it. I am hopeful that my colleagues will continue this bipartisan work with us in order to further provide these necessary resources so our communities are equipped with the tools to improve prevention, treatment, and recovery services for patients with substance use disorder. This legislation is vitally important. The Senate is ready to act. It is time to get the Support Act for Patients and Communities Reauthorization Act signed into law. I thank you for your time, and I'll yield back.